Hi, good evening. Thank you for joining us. We have some good news to discuss today, and it's always nice to have a positive conversation. So it's going to be a really quick conversation, but it's important. So the government has just announced that senior citizens above the age of 60 and those above the age of 45 with comorbidities can get vaccinated now after the 1st of March. Now, the interesting thing about this announcement is that the government has said that they will rope in private hospitals and clinics as well. You can get the vaccination for free at a government hospital. And one assumes, and of course, if you get it at a private hospital, you'll have to pay for it, the price of which will be decided by the government of India fairly soon over the next few days. And that announcement will be made as well. Joining me right now, Dr. Rakesh Mishra is the director at the Center for Cellular and Molecular Biology. Dr. Mishra has actually been really kind to be part of many conversations over the last year since we've been dealing with the topic of COVID and vaccination and treatment and things like that. And he's been kind enough to join us again today. Dr. Mishra, thank you for joining us. This will actually be the first time the vaccinations are available technically over the counter, if that's the right thing to say. Do you see this as being able to speed up the process a lot more?
Yeah, I think this was very much needed and more or less expected, because as you see from many corners, from industry, from policy makers, this suggestion that private sector should be involved. I mean, we know in the country 70% of the medical needs are met by private. So it's not that government organizations or government hospitals can handle the entire population. So it was known that is going to happen, but government had to take steps step by step. And I think so far they have done well actually in this process, because first controlling it and testing with and giving to healthcare workers, which is most important.
Yes.
Then frontline workers, it could have been faster, but considering the size, considering our infrastructure and other constraints, I think it's not bad. But now is the time. Like 1 month we have vaccinated, let's say 1 crore. So 30 crore, 30 months is not the equation. You need 10 times more or 6 times more the speed. So you have to accelerate this process, and role of private sector is important. And
Dr. Mishra, do you expect now that in the private sector that people are paying for their own vaccination, that they will be given a choice between the two vaccine options available in the market, the Covaxin and the Covishield?
I'm sure that's what will happen. That now, if you go to private hospital, we'll ask which one it is, and then you pay. You can pay different price to different vaccine. Now, it's going to depend on the market. So demand and market, natural forces will operate, I guess. And maybe after a couple of months, more options will become available, and they will be cheaper or more costlier. So those things will happen, and I think that's the right thing. At least for the needy, government providing assured access to something which is approved, and then for rest of the people who want a choice, they pay the price and can opt for it. So I think that's a reasonable thing to imagine.
Uh, Doctor, also, given all of the conversations we've had about the amount of data available on each of the vaccines, and we know that a lot of healthcare workers as well in the first round had rejected Covaxin from Bharat Biotech and had preferred Covishield from the Serum Institute. What is your recommendation for people who are going to go out and get vaccinated right now?
I think this is at the moment there is no reason to say that Covishield is better or Covaxin is better, or both are equal. The only problem with the Covaxin was that data was not released when in the beginning, when it was given, and phase 3 had just begun, and those were concerned. And but after that, Covaxin has come with a very reasonably respected, detailed study published in Lancet. So that's gave some credibility to it. And I'm sure in coming week or two, the phase 3 data will start coming in, and that will be bringing it in the data wise at par with the Covishield. And now, since there is certain number known that these many people have been vaccinated, and I'm sure vaccine follow-up is happening. So I think coming month or so, we will start getting the data from the people who have been vaccinated. They're also, in a way, kind of trial. Vaccine, the phase 4 trial is this kind of trial. When you, in fact, vaccinate large number of people, and the effect is will be seen that these people are either not getting infection or having very mild symptom. So that is the way to go, and I'm sure this vaccine hesitancy, in some it will stay, but I think most of the time it will disappear, and more and people will take vaccine. And Bharat Biotech is a credible company. They have got little bit of shortcut this time, that is was understandable considering all the situations. And I think this is a temporary thing. In my guess is in a month they will be as much in demand as any other vaccine, because the data will be available by then.
So what you're saying is that there's no reason right now to worry about the efficacy or the safety of either of these two vaccines.
Right, yeah. Actually, if you ask, if you are really plain way, the difference in two vaccines is that one is the entire virus which is inactivated and injected. So that is actually the most natural, next most natural thing, that instead of a real infection, you are having this killed virus infected. So all the epitopes, all the shape and size of the protein and all, it is exposed. So you get a much stronger, much robust immune response. Whether it is safe or not is a question, because something may be toxic, but that has been proven. While other vaccines are single protein, which is largely the protein that is that is exposed to our system is exposed to. So in that way, I would say that whole virus is marginally better equipped to deal with newer variants or wider kinds of viruses infection, as long as it's safe. But this is a very simple interpretation. Vaccine is far more complex stuff than this. So I don't see any reason that it should be less effective, to
Okay.
say. As long as it's safe, it's given properly, it should be as good.
So would you recommend then that we tell our parents get vaccinated, and then we can safely visit them as often as we want and hug them as much as we want? That's no longer a problem.
6 months, I will say. So we have to hold on for 6 months, because see, there's a reason for that. So it takes for these are 2-dose vaccines, so it will take 40-45 days for the full effect of vaccine to set in. And as you know, these vaccines are maybe effective for 70-80% of the population. So if 100 people are vaccinated, 20 will still will not be protected because of the vaccine. But if large number gets vaccinated and some have naturally got infected, then something what is called a herd immunity will kick in, and slowly, so the virus will more often than not face a roadblock, which is in vaccinated individual with protection. So then it's become much less, and then we will be safe. But that it will take. I think we can become free to move around and go to normal. Used to be what used to be 1 year back. Once a sufficient number of people, let's say 50% or so, have been vaccinated in the population, and maybe a month after that. So that will be at least 6 months we're talking about, hoping that no new nasty variant emerges which does not obey the vaccine and can bypass the protection. This is a small possibility that is always there. Every year we need new vaccine for the common cold and things like that. This virus is mutating, but mutating a little bit slower. And so far, the trend is that vaccines might be a better tool for this than the common cold we see.
So effectively, you're saying that we have to get to about 50-60 crore people vaccinated in India before we can be comfortable.
I would think that, and some who will not get by this way vaccinated, they may have got natural infection already. Some are in some other means protected. So that means the number of people who will have some kind of protection will reach 70-80%, which is higher side of the what is required for the herd immunity.
Okay. So, Doc, one more quick question to you before I let you go. That we're looking at some increased numbers again, spiking in Maharashtra, Kerala. Also, I mean, I just read a story on India Today that says that Dharavi, the slum, has reported double-digit numbers for the first time in months. There's a pattern here. Is this a second wave that we're seeing? Because we know that Europe and other parts of the world have also witnessed second waves. Is this a second wave, or do you think it's just a surge?
No, I'm sure it's the second wave is coming, and how much it will be, how far it will go, how tall will be the wave will depend on how we respond. This we means the people being COVID discipline following or not following. So there is I mean there are two reasons a wave can come. One is a slightly different variant comes, which makes the it escapes the immune system, and the second may be that people have changed their behavior and they are inviting the virus to come and infect. So in the case currently in Kerala and Maharashtra, looks like the later factor that is operating, which is behavior of the people, which has changed. We have seen local election. We are seeing marriage parties, people not wearing masks, and these are the things. Then slowly virus slips into a larger number, and then I mean that's one of the strength of this virus is very infectious. Then it starts to infect more number of people. So far, we have been following to some degree, and more results will come in a week or so. Looks like it's not a new variant that has come up, because if new variant comes, and as you are saying about the Dharavi, I am little concerned about that, because Dharavi already the number of people seropositive is very high. And if a wave comes there or a spike comes there, which might mean that some may be reinfection, and that will be a not something which we want to hear, because reinfection means even the vaccines might not be tolerated, it might not be protecting. So that is something. So there are two three ways we have to be very careful. We know how this virus spreads, so the best defense is to let it not spread, and that we can do only by COVID behavior or by vaccine. So vaccine is a good tool, but even with vaccine, it will take several weeks for effect to come in, and some people will not be protected by that. So I think if everybody follows COVID discipline, whether the person has had earlier infection or not, whether the person is vaccinated or not, if 6 months we all work together, we can see this virus off. But otherwise, it can keep coming back. And now you see the situation in Maharashtra in several places. We'll not be able to handle another lockdown. I mean, this will be very painful to have one more lockdown in the country. So the best is to keep monitoring, keep sequencing, so we know if it is a new variant or new. Best thing of the mask and social vaccine is that no matter how dangerous the virus is, the same mask will be protective against all kinds of variant. So that is our best defense.
Are we, Dr. Mishra, are we studying our cases closely enough to be able to detect new variants if they do turn up?
Yeah, so that is now process in place where there are now a network has been created of 10 labs across the country, and the samples are supposed to be collected from various parts and constantly given. So we are supposed to monitor genome sequence of 5% new cases, all new cases that come. And if people who come from foreign travel, or people where there is a sudden surge, more number of samples should be sequenced from those areas. So those provision is in place. There are high level meetings happening every day. And I think this will be in action. Already it's partly in action, but this will be in full force in the coming few days. And I think we'll be able to track the dynamics of the infection and the relationship with the genome and new variant more or less in real time, and that will be very helpful.
All right. So just to put this in a nutshell for our viewers who might have tuned in late, we have the government announcing starting the 1st of March, senior citizens above the age of 60 and those above the age of 45 with comorbidities will be eligible for vaccinations, both in private and in government hospitals. Government hospitals will hand it out for free. Private hospitals will have a cost to it that the government will announce that cap on that cost over the next couple of days. it's possible that since you are going to pay for the vaccination in the private hospitals, you'll be given a choice between the two options available on the table, Covaxin and Covishield. Dr. Mishra is of the opinion that there is no reason to doubt or worry about either of these two right now, because there is enough data to prove that they are not dangerous. There's no side effects. There's nothing to worry about. And the efficacy is fairly obvious. So it does make sense for people to go ahead and get vaccinated as quickly as possible. But keep your masks on in the meantime, sanitize. We are seeing a spike in cases across the country, and it's following the pattern of the first wave that we saw, which is Kerala first saw a spike, then Maharashtra, within Maharashtra, Mumbai, now Dharavi is reporting some cases as well. So there is a pattern that is emerging, which means that we need to be even more careful. This is not a time to let our guard down. And as much as the government keeps telling us to do it, we have to take them seriously, because we've already lost too many lives. Wear your mask, maintain social distancing, and sanitize as much as possible. Thank you, Dr. Mishra, for spending time with us and answering these questions. We'll keep coming back to this. Like we've said, this is the most important story in the country right now. This is information that comes up on COVID, is life and death information. So it's going to be our endeavor to bring you this information as often as we can. For our viewers who have joined us, remember our news bulletin will be up at 9 o'clock today. My producer Arun has promised me that it will in fact be 9 o'clock this evening. We're trying very hard to make that time. Do catch us at 9 o'clock for just the news. No fuss, no debate, remember, at 9 p.m. Thanks for watching. Good night.